From the Toronto Star, I'm Adrian Cheung, and this matters. Of the 13.5 million confirmed cases of COVID-19 around the world, 7.6 million people have recovered, according to the Johns Hopkins University COVID tracker. But what does recovery actually look like? What if you don't recover? Thousands of patients are asking that very question. Months after testing negative, they still face debilitating symptoms, mysterious rashes, gastrointestinal issues, losing their sense of smell and taste, and memory loss. These patients are known as long haulers, and they're turning to each other online for support and answers in ways that doctors haven't been able to give them. Some of the patient-led research they've already done has shown how false negative tests can play out in the early days of infection. Their experience drives home, even more than 4 months on in a pandemic, how much we still don't know about the novel coronavirus. And it's showing that there's a lot of gray area between sickness and recovery. Today, we're talking to two people who are long haulers and are helping drive research into finding out what is happening to thousands facing their experience. Hannah Wei is from Toronto. Hannah Davis is in New York. They're showing us what the fight for answers looks like. Hannah and Hannah, thank you for taking the time to talk about what you're facing.
Thanks for having us.
So I wanted to begin with your experiences with COVID. You're both recovering now, but when did you get it? What did the symptoms feel like when you got it?
So for me, I got sick. First day I realized I was sick was March 25th. So I'm on day 113. I actually had a weird first symptom. I couldn't parse a text message from my friend. And it was kind of late at night and I thought I might be just tired or something. So I didn't really think too much of it. But then an hour later, I realized I had a fever. And that was kind of the first time I realized something was wrong. And for me, the primary symptoms have been neurological. So I've had memory loss for most of the past 113 days. I've had just brain fog, complete loss of executive functioning, kind of a nonstop low-grade fever, difficulty talking and finding words or understanding what other people are saying, some pretty severe headaches, phantom smells, internal tremors, kind of in addition to, the main cough and shortness of breath and lung burn, as we like to call it.
Even a few months afterwards, you still feel like you're not really all here. You don't have all of your faculties with you.
Absolutely. Yeah. I don't feel fully present in the world at all.
Hannah?
For me, it's somewhat similar. So I've been sick since March 11th. It's quite been a while, 4 months. At first, I thought it was a cold. I thought I was getting some sort of jet lag, caught something coming back to Canada. But I realized something was wrong when both myself and my roommate got sick around the same time. And I started having that lung burn, as Hannah was mentioning. And for the past, about 3 months or so, I was trying to recover from that. I had a pretty bad episode early on, and that sent me to the ER. And when I came back, that gradually healed. But I still have a lot of coughs every day. I still can't run too much. I still get very tired if I spend half a day outside. So it's been completely different than my life before COVID. I used to be an athlete, and now I'm kind of homebound. And I have to take a lot of naps in between the day. Right.
That's something that we've heard so often about, of just extreme fatigue, that even doing fairly simple tasks, especially, you're both very young, that can be really, really challenging.
Absolutely.
How would you guys define what a long hauler is?
I think informally, I've been thinking of it as anyone who takes longer than 3 weeks to get better, which is just like, the guidelines that we're hearing from health authorities.
So when we did our patient-led survey, we found that the folks who have recovered within 20 days. And the patients who are still battling symptoms, most of them were on day 40th or later. So that's over a month and a half, when the time that we made the survey. And now it's gone to a point where it's like 2 months, 3 months. So I would say long haulers are anybody who are suffering from COVID-related symptoms for over 3 weeks.
And with this pandemic being a global phenomenon, it also means that there are survivors around the world, just like yourselves, who are facing similar experiences. And one of the ways that you're connecting with each other is online. And I understand that you're both part of a Slack channel called Body Politic. What is Body Politic?
So it's a group that it's a queer feminist wellness collective before COVID. And I think the founder and creative director both got sick. And Fiona wrote an amazing op-ed in the New York Times talking about how recoveries were not as linear or, standard as kind of they might have seemed. And after that, she started a support group and it grew very quickly. I mean, I think I joined just a couple of days after it was created and it was already at, 1,000 or something people from all around the world. And it's genuinely, you'll hear over and over people say it's a lifesaver, but really, really, it is hard to it would be hard to exaggerate how much of a lifesaver it is. It's really a community that you can go to at literally any point in the night and someone will talk to you and, share what's worked for them in this time where we have kind of few answers. It's been such a gift.
Yeah, I can imagine that it can feel very lonely to go through this.
Absolutely.
Mm-hmm. And just to build on top of what Hannah has been saying, a lot of the folks who come to this community have traditionally been marginalized or dismissed from trying to seek care. And as you can imagine, especially early on in the pandemic, when not a lot of doctors or public health was aware of the widespread community spread, a lot of these people have been turned down from testing, from receiving adequate care. So basically, Body Politic has provided a space for patients to compare notes to each other. And what we see a lot in the community are people who say, oh, I have X, Y, and Z symptoms. How are you going through this? What is helping you? And recently, the admins of the community have been bringing in health professionals for Q&A. So that's been really helpful as well for the community.
You're all trying to get answers on why these symptoms keep coming up, some of them quite mysterious, some of them brand new. Has anyone gotten answers on why these symptoms keep coming up? What do doctors tell you about these symptoms?
I think doctors are fairly confused, especially in the beginning of the pandemic. I was able to see a neurologist through the hard work of my doctor trying to get a referral when everything was kind of overloaded. I was in New York and, she told me my memory loss was just like ADHD. And that was just so concerning and kind of made me realize oh man, no one knows what's going on, that they themselves have no idea what's going on. I mean, it's been a battle that I think a lot of us have faced because doctors are so kind of used to trying to give answers that I think they're not well versed in saying I don't know, but I'm going to try to help you. They'll often kind of project their anxiety back onto the patients and say oh, you have anxiety. I can't answer this. This must be all in your head then. And I think we've all kind of dealt with that kind of thing.
That there are still so many unknowns about the long-standing effects of COVID that they can't give you a clear answer.
For sure. But also specifically that there's kind of a mentality that say that we don't have answers or that they don't have answers. They're kind of trying to make up answers and say that the answer is that we're all anxious or we all have depression or we all have PTSD.
Yeah, so I want to add that we get a variety of responses from doctors, and I don't want to paint a complete negative brush on the medical system is completely misunderstanding our situation. But yes, I do think that a lot of people who are going through this long haul have experienced, also compounded with their symptoms, a lack of belief from the public health system, from their own doctors. And it's been really difficult because when you're discouraged from seeking care, then it makes it a lot harder for you to find the right answers and to help yourself recover. For me personally, I found that doctors in the beginning were continuously referring to, oh, this must be a flu pandemic. Our flu season last year was terrible. I live in Canada, so I kind of understand we do have a flu season here. But for me, it was really unhelpful to get those answers. And I realized that after a while, when I saw that I was not getting better, I was trying to look for alternative ways to get answers. So from other doctors, calling back to my family, friends in China and trying to see if I can book something online, anything to get people to recognize that this is a problem.
I can imagine that as a patient, it almost feels like some form of medical gaslighting, that the symptoms and the experiences that you're having, that they're not real. If people keep telling you, oh, it's all in your head, but yet you're experiencing these things.
Yeah, absolutely. On the other side of things, I do have friends who are doctors or in residence, and they've been telling me that, doctors are primed to give you an answer and within don't have an answer to try to say something that at least comforts you. And a lot of times that is, oh, maybe you have depression or you're anxious about the pandemic. And I can imagine that's a really easy answer to give. So there's that.
There was a study published this month in the Journal of the American Medical Association that is about long-haul patients, recognizing that while many patients do fully recover, there are many others, like yourselves, that haven't yet. Body Politics seems to be collecting a lot of this information, and you guys are exchanging ideas and information. But what kind of research and what kind of data collection do you think is needed in the medical community to better understand what long haulers are going through?
For me, it's definitely patient-led research. This seems to be, something that a lot of patients, especially in either rare or emerging diseases, are pushing for, because we can kind of ask the right questions very early on because we've lived the experience. When we put this report out, I think we put it out May 11th, over 2 months ago, no one was talking about the long haulers. No one was really talking about, the fact that the neurological symptoms are incredibly pervasive in these groups. We saw neurological symptoms at a higher frequency for the most part. So for me, I think it would definitely be patient-led research would be the most ideal. And that's, what we're trying to do now. We're retroactively on track to publish this paper, and we're working on a second one now. But also, at minimum, you need extreme patient involvement in any research that's being done. It's so bizarre that it's not a priority. And I think, it's awful that medical practitioners are getting covered, but I think the fact that they are is going to kind of bridge that gap a little better.
Hannah?
Yeah, and I would just build on top of that and say that in the past week or so, we've seen a group of doctors come together to push NHS, which is the UK version of public health, to reassess their post-COVID program. And they cited our patient-led research and said that this is something that we need to incorporate in order for us to roll out something for that actually serves the population. And the reason for that is that NHS was coming up with a post-COVID program that prioritizes cognitive behavioral therapy. So basically what we talked about, trying to make this long COVID a psychological problem instead of a multi-organ physiological issue that we need to solve.
I mean, even the understanding of how COVID attacks the body has changed in a matter of months. First, it was known as a respiratory illness, but now we also know that it attacks the kidneys, it can attack your heart. As Hannah Davis was saying, brain function can be impaired a lot as well. So even the official line in terms of how we understand COVID is changing a lot, right?
The issue right now is that because we have more research and we have more understanding of COVID being a multi-organ disease, a lot of the patients early on who were triaged based on older understanding of the respiratory disease have fallen through the cracks. So now it's even more important to involve patients themselves into the research so that we get a better, more comprehensive understanding of how COVID actually affects the body long term.
And I mean, you could also make the argument that given that this pandemic isn't going away anytime soon, certainly not within the next 6, 9, maybe even a year, there will be more and more long haulers. There will be more and more people who are facing exactly what you're facing. And that research needs to be built up on this.
Yeah, exactly. I think it touches more than just science too. I mean, with more people in this cohort, it means that we need to look at how we're reopening the economy and how we're making people go back to work while a population of them are still disabled.
Does it feel like a fight for understanding? That this is a fight for acknowledgement that you're facing real symptoms, real cases?
Absolutely. Yeah, I think it's a constant battle against kind of the misinformation that came out in the beginning of the pandemic, even just the fact that it's a systemic and not respiratory illness, the fact that we were told that only the elderly, are going to die from this. The death rate in the US is significantly higher than the 1% that we were told. Also, the battling against the misinformation does definitely feel constant. And, we're seeing some changes in spots in major cities and hotspots, but I think it's particularly hard where people just have one primary care doctor option, or there's one specialist within driving distance or something, and you really have to rely on that person to stay up to date with kind of breaking news. And I don't think that everyone is doing that. I don't think all doctors are doing that. And it's so hard to describe just how exhausting advocating for yourself is, especially when your doctors are kind of defensive. It takes so much time. And we've heard that from the ME community where, you just don't have that amount of energy to really get yourself the help you need.
And that you're facing these symptoms already, that in itself is a big challenge in the day, never mind advocating for yourself.
Exactly.
Yeah. I have nothing more to add. That's a really good answer.
How do you hope that the talk about COVID and its treatment changes as we continue to learn more about long haulers? Is health and sickness binary, do you think?
That's a great question. I think we've all kind of been struggling with that, where a lot of us have kind of improved since our early weeks, but are definitely not anywhere near where we were pre-COVID. I mean, I would like to see, more interdependence and, how can we be helping our communities, people in our communities who are sick? How can we help each other? In addition to kind of getting more accurate information about COVID out there. One thing I've been really focused on recently is kind of the rate of false negatives in these tests is very high. At the lowest, if you get tested on day 3 of symptoms, the false negative rate is 20%, and that number just goes up. So by day 21, the false negative rate is 66%. And I think I'm living under an administration where, numbers like false negative numbers are beneficial. And it's hard to have that talked about so much where the kind of government's goal is the opposite, but it's gaslighting so many patients. It's prohibiting medical care. One of the first post-COVID clinics just opened up in New York, and they require a positive test, which is just like for people who were sick in March and April, like I was, it's just that wasn't an option. And it kind of feels like this collective amnesia about, what was happening back then. And so, yeah, I would say the things I'd like to change are kind of still around this misinformation.
This is a really weird disease. And on top of the false negatives, we've also seen that COVID comes back in waves, even if it's not the virus itself. We still don't know it. It might be secondary symptoms that come with poor immune system, whatever organ damage that has happened. So recovery is not at all binary. It's not black and white, you're mild or you're in the ICU, right? There's like gradients in between and they fluctuate. So when I got sick, I was quarantined with my housemate who also got sick. And on a daily basis, we would wake up and tell each other where we are and like the energy and the symptom scale. And it just fluctuates so much day to day. And despite the fact that we were both infected around the same time with the same disease, the way that it showed up in our bodies was completely different. So absolutely, there's very, very nuanced gradients in between, like whether you're sick or not. A lot of us in the long haul community, we still don't know if we're ever going to be rid of this disease. Like some days I wake up feeling great, but I don't know if maybe 3 days later I would be super tired and it will come back again and I have to rest again.
Yeah, even mentally, that is a big strain.
Mm-hmm.
Hannah and Hannah, thank you so much for sharing your stories, and I hope that there are more answers for you coming up soon.
Thank you. We're hopeful.
That's Hannah Wei and Hannah Davis, two patients who are facing long-haul symptoms from COVID-19. If you're facing long-haul symptoms, you can find the online community Body Politic and see the work they're doing at patientresearchcovid.com. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. Don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.